Did you know that every 40 seconds in the United States, someone has a stroke? And recognizing the signs early could mean the difference between life and death. So let's talk about it. What is a stroke? A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing the brain tissue from getting oxygen and nutrient dense blood. Then within minutes, the brain cells begin to die. And there are three main types of strokes. So let's talk about them. Ischemic stroke is responsible for 87% of the strokes that happen. It's caused by a blockage, a blood clot that blocks the vessels supplying nutrient dense oxygenated blood to the brain. And then the brain tissue begins to die. And as a result, you have a stroke. A hemorrhagic stroke is caused by a blood vessel in the brain that bursts, leading to bleeding in the brain. You have a stroke. Last but not least is the transient ischemic attack, also known as the TIA. We call it TIA for short because who's going to say transient ischemic attack all the time? So, TIA is a mini stroke. It's a temporary blockage of blood flow that resolves without causing lasting damage. Those are small strokes, and a lot of small strokes, a lot of TIAs eventually lead to the massive stroke if you don't correct the problems. But it eventually leads to a massive stroke that causes permanent damage or even death. Um, there's other types of strokes, but for the sake of this conversation, we're just going to talk about those three types. So, how does a stroke occur? Blood clots, often due to arteriosclerosis or plaque buildup in the arteries. So, when you eat a diet full of saturated fats, what happens is that fat turns hard and it sticks to the vessel wall. It becomes a waxy plaque and it causes the blood vessel to constrict or close, where free flowing blood can't just go through. And then our platelets, which are our clotting cells, start to build up and form a large clot that travels to the vessels in the brain, and it causes a stroke. Blood can't get through to oxygenate the brain, and you have a stroke. Burst blood vessels. Burst blood vessels generally come from having high blood pressure over a long period of time or trauma. But the number one cause, or let's see, the most the highest risk factor is having high blood pressure over a long period of time. So what happens is your blood pressure is high, you have a lot of pressure against the vessel wall for a long period of time, and the vessel wall weakens. And after so many years, it ends up bursting. And once it bursts, blood leaks into the brain, and then you end up having a stroke. Embolism. An embolism is a clot that forms in another part of the body, like the heart or the legs. I told you guys before how my grandma had peripheral vascular disease and she had clots that formed in her legs, and those clots traveled to her lungs and it caused a pulmonary embolism. But there's also clots that form in like your heart and other parts of the body, and they travel to the brain, and it causes a stroke, an embolic stroke. What are the signs of a stroke? So we use the acronym FAST, FAST. FAST stands for a drooping smile. So you ask a person to smile and only one part of their face go up. A stands for arm. You ask them to put both of their arms off and one just drop down. They can't raise both of their arms up. That's a sign that they're having a stroke. S stands for speech difficulty. You ask them to repeat a phrase and their speech is slurred or it drifts off. That's a sign that they've had a stroke. And T stands for time. It's time to call 911. Every second counts when you're dealing with a stroke. Other symptoms of a stroke is dizziness, confusion, vision trouble, or just plain old a patient is unable to focus. Those are signs of a stroke. The good news is 80% of strokes can be prevented by doing simple things like managing your blood pressure. High blood pressure is the top risk factor for stroke. Like I said, after having pressure on those vessels over time, over years, it's going to cause the vessel wall to weaken and eventually it's going to burst. And once it bursts, you will have a stroke. So controlling your blood pressure is the number one thing you can do to avoid a stroke. The second thing is control diabetes. High blood sugar damages the vessel walls. So the crystals inside of the sugar make micro tears inside of your blood vessel, causing the platelets, the clotting cells to lodge into those little tears, and the clot get bigger and bigger, and then it starts to travel, and once it travels to the brain and occlude, then you're going to have a stroke. You might have a stroke. You could have a small stroke, a TIA, transient ischemic attack, or you could have a large stroke. It just depends. But controlling your blood sugar is very important. Maintain healthy cholesterol levels. Remember, eating a lot of saturated fat causes fat to stick inside of the blood vessel wall and create a plaque, a waxy plaque, and it constricts. It causes the blood vessel to close because there's a whole layer inside of there of fat. And the clotting cells, the platelets, they just gather up, it causes a bigger clot, and then it starts to travel. And once it gets to the brain, it goes through the carotid and gets to the brain, it occludes, and stroke is inevitable. So keep your LDL, bad cholesterol, down and raise your HDL. I call it happy cholesterol or good cholesterol. Keep that up. Quit smoking. I don't know anyone around me that smokes anymore. Smoking accelerates arteriosclerosis, which is that waxy plaque that builds up inside of the blood vessel wall. Smoking accelerates that. Exercise regularly. Engage in at least 150 minutes of moderate activity weekly. It could be as simple as walking. It should be 150 minutes a week, and it can be as simple as getting up, walking for 30 minutes a day, 20 minutes a day. Break that 150 minutes down. But what happens when you walk, your blood vessels relax and they dilate, which is open, allowing those platelets, those clotting cells to just free flow through, and they don't have time to gather together and cause a bigger clot because they're just flowing through the blood vessels just really easily. So exercising or engaging in at least 150 minutes of moderate activity like walking will help prevent a stroke. Healthy diet. Focus on whole grains, 6 to 10 fruits and vegetable, lean protein, and avoid excess salt and saturated fats. We talked about the saturated fats, how it sticks to the inside of the vessel wall and it builds up, causing the vessel wall to close, causing those platelets to gather together and create a bigger clot that flows up to the brain, and before you know it, it's occluded and a stroke happens. Limit alcohol. Excessive drinking can increase your blood pressure. Remember, increased blood pressure weakens the vessel wall over time, causing it to burst. And once it bursts, you hemorrhage in the brain and you're going to have a stroke. Stay aware of atrial fibrillation, AFib. This is it's just a fancy name for irregular heartbeat. If you have an irregular heartbeat and your doctor puts you on medication like a blood thinner, take it because it can save your life and it can prevent a stroke. Last but not least, take your medications as prescribed for blood pressure, cholesterol, your blood thinners, and your blood sugar, diabetes medication. I have so many patients, so many people that come to me and they're not taking their medication on a regular basis. And when I ask them why, they'll say, well, because my blood pressure is normal. Well, the medication is causing your blood pressure to be normal. Or my blood sugar is normal, where the medication is causing your blood sugar to be normal. Or maybe you've changed your lifestyle and your levels are normal. But if that's the case, still do not stop taking your medication until you go and talk to your provider, your nurse practitioner, or your physician. Let them know that you want to get off the chemicals and they could put a plan together to help wean you off. Just stopping your medication all of a sudden is so dangerous and it can put you at high risk for a stroke. If you have AFib and you've been put on blood thinners, please don't stop taking your medication because what happens is those blood thinners keep your blood thin. It works against those clotting blood cells to keep them thin and it just free flows through the vessel. When you stop taking the blood thinners, then it gives those clotting cells time to gather, create a bigger clot, and it puts you at super high risk for stroke. Stroke is a medical emergency, but again, the great news is up to 80% of strokes can be prevented through all these healthy choices we just talked about. So stay informed and let's save lives together. Follow me for more tips on preventing and managing chronic conditions. That's what I do all day, every day for the last 25 plus years. Thank you so much. I am She the MP and have a great day. Wonderful holiday season. Peace.